Hi, good evening to all, and a very warm welcome to this show with a renowned doctor with us today. Last 1.5, 2 years have been extremely stressful and tough for all of us. We've been managing multiple priorities, we've been managing travel restrictions, working from home, and doing all the other stuff which we never imagined. We now see that a lot of people have started traveling, both domestically and internationally. Especially now, we are seeing an increased number of our NRI friends coming home, meeting their friends and family after almost a break of 2 years. We know travel has its own excitement, and sometimes stress. So we thought it would be a good idea to decode this element. We were initially thinking that we would have, some topic which could help us beat COVID stress. But then we realized that while COVID is almost behind us, but stress is not. So we thought that we'll get an expert today amongst us who can help us decode this element for and help us to manage it in a more effective manner. I'm very happy to introduce to all of you today Dr. Sameer Dwivedi, Medical Director of International SOS. He heads the Medical Assistance and Medical Services platform in India and is responsible for delivering quality services to international SOS members within India, Nepal, and Bhutan. Dr. Dwivedi is based in New Delhi and has a team of doctors strategically located in Delhi, Mumbai, and Bangalore, providing medical assistance to international SOS members. He's been a key resource in the delivery of efficient services through the Mumbai Assistance Center. Dr. Sameer has executed several successful medical transport missions, including air ambulance transfers, both within the country and abroad. Dr. Sameer was also invited for COVID-19 awareness sessions by reputed organizations in India, which are supported by International SOS as their pandemic management partner. So without taking much time, I would like to invite Dr. Dwivedi to kickstart today's session, which promises to be very interesting. Over to you, Dr. Dwivedi.
Thank you, Jaswinder, for such kind words. So, without taking a lot of time, we have a lot to cover. Um so let's begin with the session here. So, essentially, what I'm going to discuss is, the core issue: stress. So, worry, anxiety, stress, how stress has evolved over time, the physiology of stress, what goes on inside a body. We'll talk about different types of stresses, stress at a cellular level, and also, something that would be important to you is some of the self-help strategies that we have. The world has changed, all of us know, and the one that is responsible for doing this is SARS-CoV-2 virus. Travel was, virtually at a standstill. No one was traveling, but then revenge tourism started now, and also business travel. Um, we are slowly getting back to where we were in the pre-COVID levels. Domestic travel is almost back to normal. With the vaccination rates improving, people are gaining more and more confidence. But now what we are seeing currently is, increased travel, and travel is not just very easy. I mean, it's bringing with it a lot of stress, and all of us realize that pandemic has been like really, we've forgotten actually how to travel, and it's now that we are trying to we actually realizing the kind of stress that it kind of brings along with you. So you worry and you have anxiety and you have stress. So I'm going to decode these for you. What is worry? Worry is comes from your thinking brain, the gray matter of your brain. It originates from the cortex, and it probably has an adaptive function. It helps you to solve problems. But sometimes when people overthink, and some of those who are very good worriers, worry throughout the night, and then it causes problems. Anxiety is an uncomfortable feeling. It generally mimics a disease. You can have chest pain and think that this is a heart attack. So you can argue that one of the very important functions of a doctor is to differentiate between whether it's anxiety or whether it is a heart attack. And stress is a physical reaction. It is the result of hormones being secreted within your body, and if it affects your physiology. And this is not something new. The in prehistoric humans, we were very vulnerable to predators, and nature developed within us to help us survive what is called the fight or flight response, which is the stress response that we have. And as time has gone by, we seem to have lost control of this system. And now our stress system, the fight or flight response, kind of gets triggered by stock market changes, by relationship issues, and it continues to stay on for days and months, and that is the problem. When you have chronic stress, what you get is sometimes what you call stress ulcers. They're kind of like leopard spottings within your stomach. You have these stress ulcers. So Robert Sapolsky, who's a neurobiologist in Stanford University, he's an award-winning neurobiologist. He's written this book, Why Zebras Don't Get Ulcers. And the premise of this book is that zebras never have stress. And the reason is, zebras know where their switch off button is. When a lion is chasing a zebra, that is the most acute stress that one can have. Somebody is chasing you for your life, and it's going to make you its meal. So the zebra kind of, runs for its life. But if you see, the moment the zebra is out of danger, it is kind of munching the grass and it's happy as ever, and as if nothing has happened 5 minutes back. But that is not us. We tend to get our stress reactions triggered. That's something that was made within us and mammals, to be precise, to save our lives. We tend to trigger this reaction within us at things like I talked about stock market changes and relationship and failure in love and all that. And it just as it doesn't end in 5 minutes or 10 minutes, it continues for days and weeks. And then that's what the problem is. That's where the problem lies. So what goes on inside our bodies? So at the top of your kidneys, there are these two glands which are responsible for the notorious drugs adrenaline and glucocorticosteroids. Don't get me wrong; these are life-saving hormones which are secreted from your adrenals. Uh, but when your nervous system gets fired, these two hormones get secreted, and your lungs start because of these hormones. These hormones marinate your body, and uh, your lungs work double time. Your blood pressure rises, your blood sugar rises because you need the energy to fight the tiger or the lion. Your blood clots faster because if you get injured, you don't want to bleed to death. Your muscles get supercharged because you want to run away from the saber-toothed tiger in the savannas when you're out of your cave. And all your non-vital functions in the body stop. So you don't want to digest your food at the time when a lion is kind of chasing you for your life. You don't want to ovulate. So that's why you see in a lot of females have when they have chronic stress, their menstrual cycles go haywire. That's one of the reasons. So stress is not something that is desirable, but acute stress is not bad. We have acute stress during job interviews or for an upcoming examination or a performance that you're about to give, for example, a sport that you're going to undertake. All these bring, and sometimes we pay a lot of money to have ourselves stressed. You want to do bungee jumping, you go in for sports, etc., and that's not really bad. What is bad is chronic stress, and chronic stress can cause something as grotesque as impaired memory. It can cause sleep disorders. It can cause anxiety, depression, and remember, anxiety, stress, worries, they all overlap with each other because they're different parts of brains dealing with these three issues. You tend to have breathlessness. You can have depressed immune functions because this is one of the reasons why you have stress ulcers. So I don't want to go too deep into it, but there's a bacteria called Helicobacter pylori, which was discovered by the Australian scientists, which tends to overgrow when your immune functions kind of dampens. You have heartburn, you've got eating disorders, erectile dysfunctions, menstrual irregularities I talked about, and as serious as things as coronary artery disease, all have been implicated. Stress has been implicated in all of these medical conditions. So there's something that you must really know, how deep it goes inside you, up to your cellular level. So in our cells, we have this nucleus, and all of us know that within the nucleus is our genetic material, which is kind of packaged in the chromosomes. We have got 23 pairs of chromosomes. At the end of each chromosome, we've got these caps, which you can liken them to, the arglets that you see at the end of shoelaces, the plastic tips. So these are called telomeres. And when you are born with a certain length of telomeres. And as you grow older, the telomere length keeps decreasing. And when you die, the telomere length, it vanishes. So it turns out that, and Elizabeth Blackburn, whose picture I have in this slide, won the Nobel Prize for her work on telomeres. And so when you die, the telomeres kind of unravels itself, and you are dead. Your telomere finishes. There's no telomere at all. And it turns out that your telomere length also decreases with chronic stress. So you might want to take control of your stress so that your telomeres don't become too small. Maybe in 20 years' time, you'll go to your GP. You're not feeling very good, you're too stressed, go to your GP, you measure your telomere length, it is of a certain length, your GP advises some lifestyle interventions, you go down, do yoga, you exercise, have nutritious diet, and do some meditation and mindfulness. And then you come back after 3 months to your GP and look, can you measure my telomere length again? And you measure your telomere length, and it has increased. It's possible to increase your telomere length. Studies have shown this. So your telomere length increase, and this is a very tangible evidence that you are doing better in life. So coming back to your travel, what do you need to do to make you less stressed during travel? So there's some very simple things that you could do. Plan your travel. And where does all the stress arrive? Because you are stressed that you might get infected during the travel. Okay, so get yourself vaccinated. Very, very important. If you have not been vaccinated, get yourself vaccinated before you travel, well in advance, at least 2 weeks prior to 2 weeks after the second dose you travel. If not, if you've not been vaccinated, at least get your RT-PCR done. Make sure that you carry all your non-pharmaceutical interventions like your masks, your sanitizers along with you. Avoid touching surfaces needlessly. You might pick up coronaviruses. Keep distance as far as possible. Avoid crowded places. All of this is no brainers. I mean, we've heard this time and time again. Avoid crowded places, gyms and pools. If you're going for sightseeing, make sure that you try and choose a time where you expect the crowd would be less, so that you mingle very less with the crowd. Prefer in-room dining. That is if that is something that is an option for you. Don't enter crowded lifts. Take the stairs if that is possible for you. um, and choose your hotel wisely, so that you choose a spacious hotel, a hotel which is reputed and it takes good control of good universal hygiene precautions. Those things are really important. There was this psychologist. His name is Dan Wegner, and he was a Harvard professor. He died in 2013 from something called ALS. It's a motor neuron disease, but he's very famous for his work on thought suppression. Now he did a few experiments which I'm going to do with you right now. Okay. And I'm going to explain what it actually means. I want you all to close your eyes and think of a white polar bear for 1 minute. Think of a white polar bear in a white background. And the caveat is that you should not let any other thought, anything else come into your thoughts. Just the white polar bear and the white background. That should be in your mind. Okay, your time starts now. We'll do that for 1 minute. Okay, you can open your eyes now. I can't do a poll here, but see how difficult it is for you not to think of just anything else. And those are your worries. It just keeps coming in. So this was the first part of his experiment. Okay, and he did it for 5 minutes, but in the interest of time, I'm doing this for 1 minute. Now, the second part of his experiment was this time you close your eyes and think of everything else, anything, a holiday, your relative, or someone, anything you can think of. But don't let the white polar bear come into your thought. Okay, this is the second part of the exercise. So your time starts now for 1 minute. Okay, that's all. Now again, see how difficult it is to keep the polar bear out. One part of your brain is is trying to think of something else. Then the other part of the brain is telling you keep the polar bear out. And ironically, it kind of brings the polar bear in. And those are your worries. It's very difficult to kind of keep your worries out. And but there are strategies to help you. Okay, and third part of this exercise is something that I'm not going to subject you to, because it's going to take a lot of time and you'll get bored as well. The third part of this exercise was he asked the participants in the study to think of a red Lamborghini, and he said, focus on a red Lamborghini, and don't let the polar bear come in. So this time he saw that the number of times the polar bear came into the thoughts of the participants was far less than than if they did not have an absorbing detractor. Now, the way to keep your worries apart, this is something that I do, so I can tell you from personal experience. So if you wake up in the middle of the night, some people do, some people who are very good worriers, they wake up in the night and start thinking about all sorts of problems, whether I'd be able to meet my responsibilities, whether I will get a good increment this year, my boss is not happy with me, will I get cancer? I've got a history of colon cancer in my family. So all sorts of stuff. So when you find yourself worrying, have a nice thought to think about. I have a certain, some thoughts to think about, and I can't share it with you, very personal. But to make me feel better, I kind of deliberately take my mind there and trick my mind into believing that everything is all right and I'm not worried. So have an absorbing detractor to keep yourself out of worries. There's another way of postponing your thought. It works for some people. When you're worried too much, tell yourself, okay, I know I'm worrying too much. I'll keep Saturday between 3 and 5 p.m. I'll think about this issue then and I'll sort out the issue. I'm not going to worry the entire week. I don't have time. Okay, so I'll do it then. So that's postponing your thought. Cut back on multitasking. Now it has been done. It has several studies have been done, and it is beyond doubt that multitaskers are not good achievers. How much ever your boss tells you to multitask, it is not a good thing to do. Will you ever tell your father or your brother or your sister to drive and speak on the phone at the same time? No, because you're not even not paying attention to your driving. You're not talking very well as well. So you don't want to divert attention. That's a bad thing to do. And it has been seen that people who multitask tend to get more stressed and they are poor achievers as well. So don't multitask. And the other thing that you can do is practice mindfulness. What is mindfulness? Mindfulness is nothing but being in the present world. Always remember that your worries are projected in the future, your sadness in the past, your happiness is in the present. So you want your mind to be present. So meditation and mindfulness is a very good option for you, for someone who actually keeps worrying a lot. So if you're traveling too much, after traveling, and you're finding that you're worrying too much about the travel, do a little bit of mindfulness. It's very easy to do it. So there's this clinical psychologist in the San Francisco Bay Area who has developed this method, which he calls 3x3 method. Phil Bossie is on TED Talks. You can watch him. So essentially, what he does is he combines mindfulness with breathing exercises. So you look at something in front of you, close your eyes, and say in your mind, "This is a table," and then you take a deep breath. Then you look at something else and say, "This is an apple." And then you can look at something else. "This is a pen." So what this does is that your distracted mind, which is kind of wandering around all over the place and making you worried and changing your physiology, you kind of bring it back to the present world. You could do many things. And if this is just 3x3 method, you could practice 6x6 or 9x9 and start practicing this. And you will find that more and more you'll be able to, come to the present world. So you might want to watch this. And there are a whole lot of strategies as well. Always remember, vodka is not the solution for your stresses. You may drink if you feel happy, not if you feel miserable. So if you feel miserable, don't rely on alcohol. Always ventilate your feelings. If you have problems with I always say, don't clutter your mind with a lot of stuff. If you're feeling confused and stressed, write down all your worries on a piece of paper and just read it. Even that is going to help sort out things, and you'll still start feeling better a little bit. Always be who you are. Okay. Very famously, Oscar Wilde said, "Be yourself. Everyone is taken." So, and it's very common in the corporate world where you see people trying to behave like a D-type personality, extrovert, and you don't need to be apologetic if you are an introvert. A lot of people like Buddha, Mahatma Gandhi, and Steve Wozniak, they were all introverts and they did very well in life. So you don't need to be apologetic about it. Be yourself, be whoever you are. Deep breathing exercises are very good. Um, when you breathe deeply, your respiratory muscles, they have this nitrous oxide which they release, and which are endogenous vasodilators, which means they dilate your vessels, so BP kind of comes down. Yoga, exercise, all very good options. When you exercise, there is this hormone in your brain, it's called endorphin. It is like morphine, it makes you happy. That's why you see when people who run for miles every day, they can never stop running because they're addicted to it. They feel better. It's good for your health, and exercise is probably one of the biggest stress busters. Same thing with yoga. A lot of things help people. Massage is very good. Music makes you feel better. For me, I love Pink Floyd. I love Eagles. I love Jagjit Singh, and whenever I'm stressed, I switch on the music, and I start feeling better. Different things work for different people, and there's something called visual imagery, which needs a little bit of practice actually. Uh, Essentially, what you do is, see, when you are stressed, the hormones are secreted and your physiology changes. So your heart rate increases, you're breathing deeply, your hands become cold, you're supercharged, you're super alert. So what you need to do is trick your brain into believing that everything is all right. So you need to lie down, close your eyes, and think of a time when you went to Thailand, maybe, or Goa, and you were lying on the beach. The sky was blue, the birds were tweeting, and the children were playing around. Everything was happy. You had no worries. You make your brain believe that everything is all right, and the brain will hit the reset button. Your pulse rate will come down, your breathing will become shallow, uh, your muscles will relax, and you'll start feeling better. And then there's something called Jacobson's progressive muscle relaxation exercise, which is very good option for office goers. uh, what happens in stress is, even when you're sitting in the office and you're very stressed, you're not exercising, but when you go back home, you see that your body is aching. Why is that? Because when the electrical activity in your central nervous system in your brain kind of uh, it is very high, your muscles automatically contract, and you don't realize that. And the same thing is true. If your muscles are contracted for a long period of time, the electrical activity on your brain, kind of it works both ways. It activity, it increases. So the idea of progressive muscle relaxation is you contract your muscles, groups of your muscles, right from, maybe you can start from top to bottom or bottom to top. You contract your muscles, flex your knees, stay for 5 minutes, 1, 2, 3, 4, 5, and relax. So you could, I'm showing you right, because you can see my upper torso. I'm showing you with my hands. So 1, 2, 3, 4, 5, relax. 1, 2, 3, 4, 5, relax. Press your arms. 1, 2, 3, 4, 5, relax. Frown. 1, 2, 3, 4, 5, relax. Close your eyes. 1, 2, 3, 4, 5, relax. Smile. 1, 2, 3, 4, 5, and relax. I did this very quickly. You need to be a little slow. There's time constraint here, and it's already 20 minutes. I have noticed in the clock. So you need to do this progressively, from groups of muscle, right from the bottom of your feet to your face. And when you relax, you'll find that your brain has relaxed. Start feeling better. And these things all come with practice. This is a very good option for office goers. This was developed by Edmund Jacobson, brilliant guy. He was born in 1888, and he wrote this book, You Must Relax, in I think this was in 1934. And he's the one who's credited with biofeedback mechanism in medicine. He was a physiologist, he was psychologist, and many things. He studied in Harvard and other medical schools as well. So brilliant guy, brilliant technique. This is something that you can do. This is Hans Selye, the person who is responsible for coining the word stress as we use it today. He nearly won the Nobel Prize for it. He was nominated, he didn't get the Nobel Prize. This is what he said: it's not stress that kills us, it is our reaction to it. It's the way we carry our load. That's what I said in the first slide in the beginning. So this is very cliched statement, but it is so true. You are the captain of your ship. You are the one who decides how you respond to stress. So life is just 10% of what happens to us and 90% of how we react to it. So even if you have a bad day, take a deep breath. It's just a bad day. It's not a bad life. Okay. So thank you very much. Happy to take any questions. I finished in 25 minutes, so yeah, I'm dot on time.
Thank you, Dr. Dwivedi. I think it was amazing to hear some of the tips what you've said. I think they are enormously useful, and I must say I would start practicing some of them really immediately. Uh, Talking about questions, I think we have one or two questions which have come up on top of it. So one first question comes from Tushar. He says that when we are traveling in an aircraft, the air is kind of recycled, but how healthy it is to breathe the same air when there are hundreds of other passengers sitting in the same aircraft. So there is a bit of worry around
Yeah,
that.
you'll be surprised to know that there have been many studies which have been done on respiratory infections, including COVID, uh, uh, whether it increases in aircrafts or not. None of them have conclusively proven that there is increased transmission in the aircraft, and there are reasons behind it. Aircrafts are fitted with what are called HEPA filters, which are very good filters, and they filter the virus. And the ventilation in the aircraft circulates to around 10 or 20 times per hour. Would you guess what is the air change per hour in an ICU in a hospital? It is 12. In the wards,
Wow.
generally the hospital would maintain around 5 to 6. And even the air circulation, it doesn't go from front to back or back to front. You see the air coming out from the top, and it
Yeah.
goes behind your legs, and there are vents on the side of your aircraft, so it goes like this. So even infecting someone one or two rows ahead or behind of you is a minimal chance. And then everyone these days, everyone is mostly people are vaccinated or
Yeah.
RT-PCR'd, or uh, they are wearing masks. So the chances that you get infected within the aircraft is far less. Even at your homes, when especially in India, we have very little ventilation where it is very cold. You don't open your windows. Ventilation is a very good option to decrease transmission. If you don't have ventilation, use an air purifier, and you don't need to buy a very costly one. You can just buy an air purifier, which is a good HEPA filter and a fan. That's it. All the bells and whistles, the UV light and ionizers, they come with their own environmental hazards. So you don't really need to buy those. Just a simple one, HEPA filter and a fan. That's what is required. So don't be afraid of aircrafts. While there are so many people, and to a person, it might look that the transmission may increase significantly. There's more risk. There's actually not.
Super. That's really helpful. That was one piece which was concerning me as well when I was traveling. In fact, you have answered a third question from Rohan as well, who was asking the same thing, that whether a room purifier would help in a home kind of setting. So I think you have answered that.
So
Yeah.
just to add to, because Rohan has asked this, maybe I want to add a little bit more about the air purifiers in room. So there's a way to calculate which how what sort of how what power of air purifier you should buy. So there's something called CADR, clean air delivery rate. It is in cubic feet meter, CFM. So multiply the CFM by 60, by 60, and then divide it by the volume of your room where you want to keep the air purifier. So volume is the length, breadth, and length multiplied by breadth multiplied by the height. And this formula should be equal to around 5 or 6, which is the air change per hour that you get uh, with that air purifier. Okay,
Yeah.
so CADR multiplied by 60 divided by the volume of the room will give you the air change per hour. For normally a good, for home circumstances, 5 to 6 air changes is good enough. If you're in an AC environment, what you need to ask the guys in your office is what filter they are using for the AC. So the standard is anything above MERV 13, MERV 13. Anything above MERV 13 would filter the virus.
Okay. That's really helpful. On the note on vaccination, while in India we have made significant progress in terms of having people double vaccinated, but there are a lot of people, including somebody like us, who got vaccinated very early in the cycle, right? in countries like US and some of the other Western countries, the dosage of boosters have started. So, do you think what are your views on, first of all, the booster doses? When do you think is the right time to take it? And is it really helpful for us to kind of go after it, especially for the people who have kind of been vaccinated for more than say 6 to 8 months now?
Uh, right, as of now, the guidelines from the government of India is, they haven't said that booster dose is required, but this is also a resource issue. We've had only 55% of the people vaccinated so far, either single or both doses. In the US, what they're doing is someone who's had 6 months, 6 months past the second dose, they're recommending a booster dose for people who have risk factors. So vulnerable population, you take a booster dose. Now, the essential thing to know is that while your antibody levels may go down, that's not the only level of protection. Immunity has various levels of protection. One is the antibody, and then you've got memory cells. Okay, once your antibodies kind of wane down, you have these memory cells which are ready, which have recognized the virus, and next time when the virus enters, they quickly turn into plasma cells and start producing the antibodies. This takes around 5 days time, and 5 days is the incubation period of the virus. So by the time the virus comes up with symptoms, the protection is already there. And that's not all. There's something called cellular immunity. There are other cells which kind of come and um, attack the virus and kill it. But because antibodies can be measured easily, we take it as a proxy of immunity. So we measure that, and if the antibody levels kind of fall down, we say that immunity is being. But it's not something really too much to be worried about. But yes, again, we've seen with other vaccines, booster doses help. And there have been countries which have started booster doses, and even mixing and matching of vaccines are being done. Any other vaccine that you take, apart from the ones that you've taken, kind of some studies have shown that the antibody levels kind of increase, the immunity kind of increase even better than taking the same vaccine. So right now, I mean, for Indians, there's little choice because the government doesn't allow this.
Yep. So I think a lot of our audiences still kind of have some questions around COVID. So there's a question around, if you're traveling, is it good idea to double mask?
Yes, it is. Yes, it is. Okay. Two things. One is a surgical mask and a cloth mask together. So with the surgical mask, you get a protection of 60%. You add a cloth mask, protection rises to close to 91%, which is almost as good as a 95% N95 mask. Now, coupled with this, if two people are wearing masks, 60% protection, 60% protection, you get 91%, and then 6 feet apart, you're 6 feet apart, you go as high as 99%. So there's no, one band that kind of kills all the bacteria. The important thing is you have to have this multiple levels of protection, the famous Swiss cheese model, where you also have the hand washing and your mask and your double mask and the social distancing. This is what actually protects you. Having said that, what I do, and sometimes it's always not practical. When I go to not so risky places, I have my cloth mask or my surgical mask. But when I'm going to the grocery shop, when I'm going to the hospital to meet someone, I have my N95 mask on. So that is what I do. I mean, but double mask is definitely an option. N95 masks fit you tightly, so you kind of sweat a little bit. It's not very comfortable. So some people find it difficult to use. So if you're one of those person, you might want to use it sparingly, especially in those areas where there's increased chance of transmission.
Yep. So there is one last question which I'll pick, and probably we know the answer, but I would still want you to probably answer it in your way. There's a question from Tarun which says that if my entire family is vaccinated, do I still have a chance that I'll get infected?
Oh yes. Even vaccinated people can get infected. They can even transmit the virus to other people. The thing is, the good thing about the vaccine is that they at least protect you from getting hospitalized. They protect you from fatalities. In most cases, there have been people who've had the vaccines and who've actually died. And even with Pfizer vaccine, there was this famous case of a Indian doctor traveling from the US to India. Uh, he had got both his Pfizer vaccine doses. He felt protected, came here to help his family, and he died of COVID here in India. So it is not foolproof. But if you look at it from a 35,000 feet view, if you look at the percentages, there's a lot of protection. And people who have not been vaccinated, I would earnestly urge them to get themselves vaccinated. It is safe. That is what you should do as an informed person. And this is a public health issue. It's not just about you. It is about everyone.
Yep, absolutely. I think we all need to behave responsibly even when we are vaccinated. So that's a point I'm taking away. So thanks, Dr. Dwivedi. I think we had a great session today with you. I'm sure all our viewers have benefited a lot from some of the tips what you have given to us. Stress is going to remain in our lives in some form or the other, and as you rightly said, it's our prerogative how we kind of react to it and how we fight it. So I think we need to acknowledge stress is going to be there in lives, but we need to find a way to kind of beat it. And the session today, probably helped us to kind of find some ways to decode this element. I really thank you on behalf of our viewers and HSBC for your session today. It's been a great learning one, and wish our viewers all the best, in this fight against stress. Thank you and good evening.
Thank you, everyone. Good evening and good morning, wherever you are.